we just thank you, Lord, for this afternoon, that we've been able to come together once again. We thank you for this blessed day that you have given to us, and thank you for the health and the life that you've given us to enjoy. And most of all, Lord, we just thank you for your Son, Jesus, that he came for us, and for your love, mercy, and grace that you bestow upon us. And Lord, we just ask that you go with us now into this meeting, that you just bless us with the wisdom and knowledge to know your will and to understand what you would have us to do. All these things we ask in Jesus' name. Amen.
Thank you, brother.
Thank you.
Next we'll have roll call. Sir?
You lost your gavel privileges.
Oh, I did?
Did you read that memo I gave you?
I'm trying to, absolutely.
Joe Crittenden.
Here?
Linda O'Leary. Bill Angel.
Here.
Bill John Baker.
Here.
Jack Baker. Audra Carter. Meredith Fraley. Chuck Hoskin.
Madam Chair, or Mr. Chairman.
Yes, Mr. Baker?
I have a resignation before me, respectfully submitted by Councilman Chuck Hoskin to be removed from this committee, and I so move.
Second. Motion and second to Chuck's resigning from the Health Committee?
Correct.
All in favor, aye?
Aye.
Any opposed? Okay. Did we have a quorum?
I haven't finished it.
Okay.
Don Garvin. Patrick King.
Aye.
John Keener. Jackie Rob Martin. Melvina Shopouch. David Thornton. Gary Calvin Watts. Phyllis Yardsey.
We have a quorum. Next, we'll approve our minutes of the March 13th meeting.
Second.
Motion second. Any discussion? All in favor, aye?
Aye.
Opposed, same sign. Minutes are approved. Ma'am? Continuing on with our agenda, we'll go into our reports, and Jim, you're up first again. Now, you guys can shuffle that if you want to. It doesn't matter. But if you'd like to be in first.
They threw me into the breach. OCO. I decided Ed's in Reno at a business office meeting, and I decided to stick around and catch up on emails and paperwork, and we did our closeout today on our housekeeping edition, and it is complete with a few minor things that have to be taken care of as you would expect. And so that allows us to get to the point that we're seriously thinking about how we're going to design the emergency room. And so that time marches on. In your handout, Nikita Bright and Karen provided nutrition education in a lunch, a brown bag lunch and learn series, and 71 employees participated, and I took my sandwich in there, and they immediately told me that it was not fat free, and so, but it was a good drill that they were putting on. Our diabetes program held a diabetes alert day, and there's a handout in here on that. In our we've been having problems with viruses in our system, in our server system, and then we've also had problems with our area office turning off some ports and not telling us that they turned them off, and we thought the viruses did it. So it's been an interesting drill to go through that. We're still cabling putting the Cat 6 cabling in for the to make our computer system even more efficient. Our outpatient visits are down, adult admissions up, newborns down, and we had Dr. Knife Chief has tendered his resignation, so we're going to be replacing the advertising for his position. And we're still backlogged on our PCCs, but we did get our VPN access finally for our coders, and hopefully we will be able to catch up on a backlog, which will in turn we feel will increase our collections, which also are down because of the backlog. CHS, we have 568 denials, 1,721 unmet needs, and then our case manager is keeping a good, is working the cases on our chef cases, and that's going to be beneficial to us. And on the budget concerns me because we're going over to the unified financial management system, and so we had to, it's a whole new system, and it's going to be very interesting to learn how to do the workarounds, do journal vouchers, the whole 9 yards. We had to move all of our salaries and benefits into our operations budget, and that really concerned me because of the way it affects cash flow. And but stay tuned, we'll have more on that. I attended the grand opening at Clinton, and that was very good. And we had a women's health fair held at the Claremore Expo, and Ellen Simmons coordinated that on my behalf. We had a procurement conference in Catoosa at the Cherokee Nation Casino, and I was asked to, I opened it up for, since that's in our service unit, I opened it up for Rhonda Long Break, and we celebrated Doctor's Day. There's the vacancies to give you an idea of our vacancies. In our bullet points, John Daugherty has returned back to work on full-time basis, and we're going to have the joint committee conference, and it will be next week on the 24th and 25th, hosted by Hastings and Cherokee Nation and the Tulsa Urban Program, and it will be at the Hilton at 91st and Elwood. We have received our appropriation, but it still will be advice out on a quarterly basis, so we still have to manage our funds very closely. And I'm in the process of writing a letter to do all the necessary things to what?
I was talking to Ida.
Oh, okay. I thought, the mic went out. Oh, okay. Let's see. We have got our appropriations, and we still need to manage our budget because of the UFMS. Our EHR, we're having to slow down on our EHR a little bit to allow our coders to focus upon reducing the backlog, and but we're still on track with that. And our accounts receivable is at 2%, which is the lowest for our facility to date. Acquisitions is working on our digital radiology procurement, which is to equip our second room, and that we're shooting for May, but GE is wanting to do June, but we're going to see if we can't get them in there in May. We finally got our laundry contract after several years of being up in the area office, and they did it on a 5-year contract with a base contract and option years. We have approved automated technology in pharmacy, which should speed up the operation, and we'll get one robot that'll put the lids on, and it just works around the clock. So, and then we're upgrading our Omnicell system throughout the facility. We're still working on trying to get concurrent jurisdiction, and we're in the process. Unknown to me at this time, but we still pursue it. We need it. What's the sheriff's name? Mickey Pierce.
The chief of police for Claremore actually wrote letters
Right.
to our congressional delegation and sent,
So,
and I alerted Paula.
so they're the local law enforcement are supporting us. And then there's what they did on diabetes. The agenda, I put the agenda in on the conference that they're going to have at Tulsa Southern Hills. Is it still at 91st? Is that the same place?
No, it's not 91st.
71st. So it was 71st and Lewis, isn't it? Close to it?
71st and Loon.
Yeah, okay, that's where it's going to be. I missed it for you.
And I'll put that agenda in their packet.
Okay. So it's there as well. And for your edification, we'll give you an idea of what we're covering. And let's see. And then if you want to get into a golf tournament, on the last couple of pages, there's your Indian Health Service Joint Conference Committee Golf Tournament on Monday the 23rd. We're going to have a scramble. Entry fee $40. That includes the green fee and the cart rental. Prizes for first, second, and third place teams. Any questions?
Any questions for Jim? I thought somebody would jump at that golf tournament thing there. Maybe we're too full. We had a big.
There you go.
Was that nutritional sandwich that you had in there?
I had the healthy sandwich at Del Rancho.
Del Rancho. They're good though.
They're good.
Thank you, sir. Good report. Next up, we have the Hastings Medical Center. Who's going to do that?
Good afternoon.
Good afternoon, ma'am.
For those of you who don't know who I am, I'm Kathy Holcroft, and I'm the chief nurse of the hospital all of the nurses. And Mr. McLemore asked me to stand in for him today since he is at a business conference. And so your information will probably be mostly provided in the packet. And I just have a couple of things probably that need to be emphasized is the fact that we did have an important visit from the dignitaries from HHS District 6 on April the 13th, and they were actually visiting with Cherokee Nation and came by our hospital to take a tour, and we enjoyed having them there. The other highlight is the fact that we finally closed on the 8.5 acres that we've been trying to purchase for a significant amount of time, and we were very pleased to finalize that and get that under our ownership. It was finalized on March the 29th, so we were pleased with that. We did have a large out-turn for our Easter egg hunt. The Employees Association provided that, and that's about all I have. And I'll be glad to try and answer any questions that you might have.
Anybody have any questions? Looks like the clinic construction's coming along good out there.
Yes, it is.
According to the pictures.
It's doing well.
I hadn't been out there in quite a while, but it's coming along real well.
Come out and see it. We'll take you on a tour.
Mr. McLemore usually has a short conversation with Mr. Keener and...
I was going
Mr.
to
Martin.
abstain from that today if I could, please.
I understand very well. But the offer was there in case you wanted.
That's all right. I'll pass this by.
Any questions for Amanda?
Comment.
Comment.
I was scared. She's a lady.
Oh, is that what it was?
Yeah.
Okay, I understand. Thank you, ma'am.
Okay.
Next, we have Melissa Gower with Cherokee Nation Health Services.
Good afternoon.
Good afternoon.
First, I just wanted to say that if y'all would send a good thought toward Tammy Marshall's way. I know you all know her, and she staffs this committee for me every time, and Ida Weber is graciously doing that today and is doing a great job. But Tammy lost her 2-year-old grandson and had his funeral services yesterday, and so we attended those, and our thoughts and prayers go out for her and her family. Also, we have a phlebotomist clerk at J Clinic, Fonda Davis, that lost her 16-year-old daughter this weekend. And so also if you'd send some good thoughts and prayers to her and her family. In March, Cherokee Health Partners performed 133 procedures and had a net gain of $39,000. We continue development on the PACE program and have been conducting interviews for the medical director and the program director for that program. It's moving along well. Oklahoma Healthcare Authority has approved our application. It's on its way to CMS in Baltimore, and hopefully we'll get to open around January of '08. So that's moving along very well. And we've an update on medical director. We've interviewed several, and we have an interview in a couple of weeks with a physician that is actually a geriatrician, so that if that works out, that would be very good for the PACE program, because geriatrician is a specialist in elder care. That's my layman's term. I'm sure Dr. Green would have a much more technical term. So that's good. So we're excited about where we're going with that program. We continue meeting with OU on the development of our diabetes and cancer programs. And I think, as Jim said, next week the Cherokee Nation is co-hosting the Indian Health Service and Urban Center in Tulsa meeting in Tulsa. I put an agenda in your packet. We'd be glad and honored for you to attend any or all of that. I think the opening part of it is the first morning, and then the second day we're actually having a tribal health leadership breakout session. So we're doing that, and set up the golf tournament. I don't know if anybody likes golf. I don't know how to play golf. I'm sure I'd love it. I went with my nephew one time, Casey, and I hit all of his balls in the water, and he's never taken me again. So I probably won't learn anytime soon. Our construction projects are moving along at Salisaw. We are still working on the finishing on the floors and acoustical sealing and painting. Nowata, we are completing the plumbing and the heating and air and the metal roofing, and the insulation and drywall has begun. Muskogee is breezing along very fast-tracked. We looked at some pictures this morning from January to March to yesterday, and it was amazing how much difference it is. So they're really moving fast there. We continue to negotiate and work with Indian Health Service on getting our staffing and operational dollars for Muskogee, and seems like nothing we ever do is simple and easy, so we're continuing to work with them to try to get that money released, and we will get it. It's just a matter of time, I guess. We have completed our selection of art for Nowata and Salisaw, and those are all at the framers being framed, and so that should be completed in the next couple of weeks. Dr. Graham has been working with Tahlequah City on some other partnerships. We're looking at some other physician specialties to bring into Tahlequah area. And we have been working our community health programs under Dr. Grimm's leadership, has been developing a worksite wellness proposal for Cherokee Nation for all of our worksite, not just health, but all of Cherokee Nation. And we have a proposal in the process, and we're excited about that. I think that will help the tribe all around in many facets. She's also continuing to work on finalizing the pandemic flu plan. working with risk management and emergency management to do that. So we'll be right in line and on time frame with the other health entities in having a pandemic flu plan. On March the 30th was Doctors' Day or Providers' Day, and we recognized all of our providers, and they were very appreciative for that recognition.
Melissa? Mr.
Yes.
Baker, you want to ask something?
Jump back from Scope Clinic just a
Okay.
second. Today, we've got a report in employment about how much Taro, how many Cherokees were working at Muskogee Clinic, and those numbers were worse than any project that Cherokee Nation has going, as far as Cherokees being employed or Taro vendors.
Okay.
And you were named personally as the culprit. Well,
That's quite interesting.
And I guess my question is, on these contracts that you're approving, are you seeing Taro vendors as an option?
The answer to that, it sounds like a cop-out answer, but I don't approve those contracts. The only contract I have that Health Services has is with C&I Construction Management as our construction manager. That's the only contract I have.
And they
How they get the work done is up to them. I have no say-so over that. I don't see any contracts. I'm not in that process. I assume that they use, I really don't know what they use. I assume that they go by some of the same purchasing
And I really
policies that we
believe
do.
that what you're saying is probably is accurate.
I mean, I'll be glad that if I need to do
This morning
something.
when the whole answer was Sean Terry and Melissa are the owners, and they're the ones making all these decisions. That's why we're not using Taro.
Well, I can assure you that Taro is in my heart, and if I had a say-so, we'd be using them. But I don't approve those. I've not ever even seen a subcontract. If that is within my responsibility and I'm not fulfilling my responsibility, then that's a performance issue I have, and I'll take care of that. But
I mean, if you can help the situation
okay,
where we can, get Taro contractors involved and so that the numbers are not visible 6% or 2%, I'm sorry.
interesting.
2%. And the last thing I want is you to be the fall guy.
I appreciate it. I don't mind owning up and taking responsibility if it's my responsibility, but
But I really do think we need to make progress in that direction with Taro vendors and
I'll check into it and see what's going on.
Mr. King, had got a question.
Just a quick follow-up on that. If you're not signing, then who is?
Well, I would assume that C&I does that. My contract is with C&I,
Right, and what they're saying is...
and then C&I subcontracts out all of the work. That's how I assume it
What they're saying
happens.
is that, how they pick that team, they're passed on the bucket of responsibility, and that's the way the model's set up. I mean, it's just saying that the owner controls it ultimately, and that's, a convenient way, to say that, we're not responsible for the numbers. So what they say they are, presenting to you and to Sean is, here's our recommendations for what we're going to do. Maybe it's more of a question of, you getting with them and saying, let's understand the roles and responsibilities.
Okay.
Because I mean, this.
Well, I have an agreement that outlines those, but I'll be glad. I'm going to check into it.
Because
promise you.
of all the
As soon as
projects,
we get back.
there's 3 health projects,
I know.
and the other 2 are doing really well in terms of Taro. And that employment committee has just been brutal over the years, making sure that we push all of them.
Absolutely, I agree.
And
I couldn't agree
that
more.
was 43% done, and then there's only 2% Taro. And I've never seen one that bad. Now, apparently, there's one of the vendors that's doing, could be upwards of 20 or 30% of the total project could be Taro, but they don't want to be Taro certified. So, I mean, the opportunity's ripe, I would think. But I would hate to see you getting joined in on that employment committee, getting grilled every month for every decision.
I don't mind being grilled if I have responsibility for something.
Well, when I asked who the owner was, because they were...
Yeah, we're the owner. We are. We are the owner. I agree with that. I'm definitely the owner. The health services is the owner of the project. But we have a contract with C&I Construction Management for them to manage the project.
Yes, and they come to you.
So they
and
subcontract.
Get sign off for it. The responsibility is going back to you, is what they're saying.
I have not signed off on any contract.
Maybe Sean is, I don't know, you need to review it or
Okay.
whatever.
Okay, let me find out so I can know what
If I
I'm
can help,
talking
I'll be
about.
glad to.
Okay. Thank you, I appreciate it.
Homework.
Okay, let's see where we're at. We continue to, in recruitment efforts, and Dr. Grimm has interviewed several physicians lately. I think we still have a couple of vacancies. We actually went down and provided a presentation to the graduating nursing class at Langston University last week. Our diabetes program participated and set up a display in the Capitol for Diabetes Awareness Day. Our patient satisfaction survey we do 2 a year, one on quality of care and one on access to care. Our access to care one is currently in progress, and we look forward to those results. And then once we get those results, we go through them, and depending on the score that we've benchmarked against, we do action plans and implement things that will increase that satisfaction. We just completed our all health employee satisfaction survey, and it was much higher. It was higher than it was last year. Last year it was about 77%. This year it was 87%. And we have a plan of action. We met yesterday to try to address the issues that are still outstanding there. We just got our staffing patterns for nursing in all of our facilities updated so that we are moving toward a more patient-centered case management system. It's a really good medical system, and we're excited about it. We've just got a couple of positions we got to get filled before we can fully implement that. Our IRB approved 3 protocols last month. We've worked on a couple different research support activities. One is we just received a grant from the National Library of Medicine. And as you all may know, about 2 years ago we received this grant and was able to put in computers and internet access to Medline and general internet access in our community buildings that we had. This time we got the grant, and we're going to put them in all of our waiting rooms at our health facilities. So we're excited about that. It'll increase access to that information and to other information for patients that are in the waiting area and have more educational things for them to do. We are currently looking at setting up a rheumatology clinic through one of our research projects that we're doing, and are currently are getting ready to conduct an epidemiology study to see what the prevalence of rheumatic disease is in Cherokee population. At J Clinic, we dedicated and completed our WIC breastfeeding room there. That's the place for the breastfeeding moms that come into the clinic to have a place to be able to do that activity. We have smoking cessation classes going on there and weight loss classes. We have 13 community people in our weight loss class at J. And our dietitian there, Amanda Burgess, is the instructor. Wings, for the month of March, we had 13 different events, all the ways from runs, walks, to bowling, to other things. We have 1,240 active Wings members currently. Our tobacco control and prevention program, we're doing a lot of work in schools. We had a youth rally in Tahlequah with 800 kids. We had a volleyball tournament for kick butts volleyball tournament at Watts with 46 participants. And we got 7 SWAT teams, which is students working against tobacco, going on right now. We also, other school and youth activities, we're working with 17 different schools that were grantees on a school health index for 2007. We've conducted youth tobacco surveys in 10 area schools, and our residential camps are scheduled from May 21st through the 25th and May 26th through the 31st. I told you last committee that I would bring over this time.
She has them.
She saved me. I got over here and I thought, oh God, I was supposed to, and Tammy had those, so I apologize. But these are the residential camp brochures, so you'll know for your area, in case you have children in your area that might want to attend any of our healthy camps. This is a list and schedule and registration form and stuff of them. So I wanted to make sure you had those, because I'm sure you run into children all the time that it would benefit to do that. Our steps to a healthier Cherokee Nation. We've been doing lots of things there, working on the worksite wellness and working with the YMCA on community recreational facilities that we're working on trying to develop, and some state evaluations by the state on our behavioral risk factors.
Melissa, Miss Yargy has something. I was reading this camp deal. I'm sorry.
Okay.
Miss Yargy?
Thank you, Mr. Chairman. I have gotten these at school and noticed the dates. We don't get our school until May 30th, so that'll prevent a lot of kids probably from being able to take advantage of this camp.
Okay.
It's the snow days, and we had about 6 days added to our school year.
Oh, yeah.
So I'm curious to see how many kids will get that.
We probably set those up before
Yeah,
we
way-
had all the
way
bad
before.
weather.
Yeah.
It's really hard to get places to hold them, so you have to book them so far in advance, but that may be
Have a
true.
bearing on your numbers.
Yeah, it might be. That's true.
Mr. King?
Thank you, Mr. Chairman. Couldn't help but notice there's a little bullet here that says must live within the 14-county Cherokee Nation jurisdictional area. Can you tell me the rationale for how?
Well, we pay for that out of our STEPS grant that we got from CDC, and that's one of the limitations in our STEPS
So
grant.
it's all federal dollars behind it?
Now, we did, that's still within the 40, even within STEPS, the initial restriction is like 5 counties. I can't name all of them, but there's like 5 counties, and then the second restriction is the 14 county. So we gave 17 grants to schools, but they're all within the 14 counties, but not necessarily in that initial 5, where they hold their own day camps. These are just the residentials that we're holding. Schools are actually holding their own day camps, and we would not prohibit a school from outside of applying for that.
Okay.
You know, because we do like 4 outside for out of travel dollars,
Thank you.
but they have to apply for it.
Mr. Baker's got a question.
Melissa, quick question. Would it be out of the federal realm if they had 2 or 3 outside the 14 counties that they wanted a scholarship with maybe their community assistance dollars or something like that, where they could still come to this camp? Or is it strictly federal dollars?
You mean where we could show that we're using tribal dollars for that person or
for a
something?
few of those people outside the 14? I mean, I don't know that they'll get any.
I
but-
think we could do that.
Yeah, I know.
As long as we can show, like as long as Lisa Pivot can show that we're not using the STEPS dollars for it. And that's kind of how we did on this other one that I was telling you about. Because we started out within, and I said, you know, we really need to extend it, and we can't do that with STEPS. And I said, well, maybe we could supplement with some tribal dollars, but just, I don't know how you do this. I'm sure the accountants know, but somehow you just show that those tribal dollars are for the ones that are outside of that area. So I think we could probably do something like that. I mean, I'd be willing to look at it if there was someone that wanted to do that. See if we can figure it out. I'm sure it's an accounting
I'm sure so.
and reporting issue to the federal
I was
government.
saying, if you got a slot or two, then maybe.
If you have somebody, Taylor, if you'll let us know, we'll see if we can figure out how to do that.
Okay.
Community health nursing made about 160 home visits this month. EMS had 260 calls. Jack Brown is at a census of 22, which is on overload. So, but that goes in and out by day depending on when one graduates and one comes in. Our behavioral health staff saw over 3,500 patients in the month of March. In your packet, I think, is the charts that you can see all of our patient visits. Also, I wanted to tell you and highlight that the dental assistant training program that we started to prepare for our dental assistants at Muskogee Clinic, we just did our own training, VOTEC program for that. They're doing their internships right now. They've completed their classwork, and we have 2 students at Jay Clinic, 2 students at Hastings, and 2 at Stillwell that are completing their externships. And we're met with Career Services. We have a partnership with them. We're starting another class that will graduate in November. So that's been a really good program, I think, that's offering some training and viable job opportunities for Cherokee citizens. So we're excited about that. I attached a copy of the health policy update for health, of the policy and legislative things that we're working on. And then the JCC agenda that I talked about. Our patient visits. Our third-party revenue is doing very well. We continue to focus on that. For 07, our annual budget was $12.8 million because that's what we collected in 06. For this year, through 6 months, if we stay on the same track, we're projecting $15.3 million, which is about a $2.5 million above what we collected last year. So we're excited about that, and the efforts focusing in that area are paying off. And that's
Ms.
all I
Sharkey has a comment.
Okay.
Phyllis?
Thank you, Mr. Chairman. Melissa, I had a question the other day about a young man takes dialysis, and I guess they have to pay, part of it's paid by, I guess, Medicare, okay, something, he's a young man, and he still has a portion of expenses that he has to pay for, you know, he's on this limited income, he has a child.
To use Salisal Clinic?
Salisal Clinic.
Yeah.
Do we want?
Yeah, we could probably help that through contract health. It should be going through contract health.
I think he tried something, and he was told that
If you'll-
Salisal didn't do that or something.
Yeah.
Well, we don't do it internally, but it could go through our contract health system.
I think he was referred by somebody from Salisal to check it out.
If you'll give us his name, we'll check into it and
All right,
see.
thank you.
Give his name to Dr. Grimm, and she can check into it and see.
Thank you. Thank you.
Welcome. Melissa, did you say that was?
Yeah, that's the end of my report.
Any comments or questions from Melissa? You know? Taylor, do you have your hand up? Okay.
Thank you.
Thank you, ma'am. Good report. Next, new business. We do not have any. Old business the same. Announcements. Next meeting is tentatively scheduled for May 15th at 1 p.m. Anybody got anything? Mr. Baker?
This is the best job you've ever done, Joe. I move for adjournment.
I have a motion and a second. All in favor? Aye. Thank you for that comment. I don't know where the gavel went. Don, he took it away from me. I didn't break it.
I took it away from you all.
Well, I like it when Don rattles.
I almost caught French.
How we doing, guys?